What?
Good group.
We're good? It's all good. Here or not, I'm moving on. So, test on Sunday? No, just kidding. So as scheduled, we will do the test then next Wednesday. So Monday we will not have lecture because we're going to cover everything today.
Just be happy.
So today we're talking about hemodynamics. So again, I know that having the hemodynamics class in ICT, we start to think that hemodynamics is everything to do with Wigger's diagrams and that sort of thing and pressures. That's a small part of it. So what is hemodynamics?
The movement of
Good
blood.
question. Yes. So the heme.
It's a thorn in my side.
It's a thorn in the side. I understand. So what does the heme refer to?
Blood.
So blood, but specifically in the blood,
Hemoglobin.
iron, the hemoglobin. So that's what it's referring to, and then the dynamics is what happens with the blood. So vascular stuff, any of the stuff in the veins and arteries in the heart is considered hemodynamics, and any effects that we see from that are a hemodynamic effect. So today we're going to talk about a few things. It's not totally inclusive of hemodynamics, but I want you to think about the lab that we did recently in physics where you had to go through and draw waveforms, draw what it looks like when we have a stenosis, after a stenosis, if there's blood clots, what does a normal hepatic vein look like, Doppler, what does that look like? All those things are hemodynamics. So in Echo, what I'd like you to do in your portfolios is to go through and maybe make what the waveforms should look like in various situations. For this class, this quarter, you definitely need to know what normal looks like on all these waveforms. As we talk about pathologies more next quarter, we definitely want to start getting into what it looks like in various pathological situations. And then the whole point of Echo is to not just take pretty pictures of the heart and the different axis and send it off to the doctor. Our job really is to diagnose it for them by our images. So your images should be telling a story of the diagnostics of that patient. So whatever we show in our images, having good proper angles, things like that, being able to show good windows where you're showing clearly the pathologies that are going on, you're telling the story of what's happening with that patient and contributing to the diagnosis of that patient. The downfall to that is that sometimes we can misdiagnose by leading them down the wrong path. So understanding what your stuff should be looking like, understanding what's associated with those things, what secondary effects there are, will help you be a better diagnostician and write better reports that will help the doctor make the correct diagnosis and not lead them down the wrong path or miss it altogether. Okay? So I've already drawn out some of the stuff here on secondary signs. So what is a secondary sign of hemodynamics? What is a direct sign of hemodynamic changes?
Turbulence.
Okay, so direct Doppler information that we see in the actual flow area that's having the issue. That is direct information. Secondary information is what does it look like in other things that we may not be directly looking at. So for example, just two examples of this are the anterior mitral valve leaflet flutter. So normal M mode of an anterior mitral valve leaflet is going to look sort of like the little mountain peak over here. That's what we normally see. Now if I've got a hemodynamic change on the aortic valve where it's got a really leaky valve, so I drew the picture up here in long axis, if it's eccentric and it's kind of going down this leaflet, this is continuous with the anterior mitral valve leaflet. And if that regurgitation goes along there, it's causing turbulence as it creates that jet. So that jet, if I'm looking at this in 2D and I don't have color on and my cursor's going through there, it's going to look something like this, where the anterior mitral valve leaflet's kind of fluttering because of that turbulence that jet's pushing along the side of it. Another sort of secondary sign to that is that my aorta or my anterior mitral valve leaflet's not going to come and touch the septum or come close to the septum and give a nice peak because that jet is pushing down on it, so it can't open all the way. So those are secondary effects of what hemodynamic things are going on. So again, just an example. Another one we talked about before is the aortic valve not staying open all the way through the cardiac cycle because of a low cardiac output. So let me ask you, what can cause a low cardiac output? Say what? Gotta say it louder, I'm deaf.
Hypertension.
Hypertension, okay. Hypertension is not going to cause low cardiac output necessarily, but it's going to cause some resistance. You said something where?
Hypotension level.
Okay, hypotension, yeah, is that what you said?
That's what I said.
Okay. Hypotension being low blood pressure. What causes a low blood pressure?
Left ventricular dysfunction.
Yes, absolutely. So it's not squeezing the way that it should. I might have, the poor diastolic function is actually going to cause bigger pressures and stuff like that, so it's not going to affect it as much. But poor systolic function will. What causes my left ventricle not to squeeze so well? Potentially. Okay, heart attack. Okay, so if I get coronary artery disease that's caused some blockages, I've got hypokinetic walls, akinetic walls, stuff like that. I'm not